Hi there. Today we are going to go over verbal behaviors in ABA, and we're going to cover a couple of things. First, we're going to cover the importance of verbal behaviors, and then we're going to cover the four main verbal behaviors, so echoics, intraverbal behavior, mands, and tacts. So let's get started. The first thing we're going to look at is the importance of verbal behaviors in ABA. Just like any other person, our clients need a verbal behavior in order to communicate their wants and their needs. The ability to communicate not only grants them access to reinforcement, but pairs us with the reinforcer as well, making our presence more reinforcing. Before we look at the four different types of verbal communication, it is important for us to note the difference between vocal and verbal abilities. Vocal abilities refers to anything that is spoken, so our speech, what I'm doing right now. Whereas verbal abilities are language that is used in order to communicate with another person. So vocal behavior is a verbal behavior, but so is sign language, pointing, writing, or even reaching for some of our clients. All right, so the first verbal behavior that we're going to go over is the mand. And an easy way to remember what a mand is to think of the words command, demand, and reprimand. So they're all requests. Mands are usually the first behavior that is taught to our clients in ABA because it does not necessarily need to be vocal. It is used for the clients to express their needs. So to ask for a break if allowed by a senior, or to ask to use the bathroom, or to mand for preferred reinforcers. Some of the ways that we teach manding are both through gestural and eye contact, especially for our kiddos that don't have vocal capabilities yet. So gestural can look like pointing or reaching for a preferred item. So during a preference assessment, you may hold up 2 or more items of reinforcement and then reinforce them pointing to an item or reaching for an item with access to that item, and then high verbal praise as well. The prompting procedure for gestural manding often looks like first doing errorless, helping them form a pointing finger or helping them reach, and then fading to a partial physical, a tap on the elbow to initiate raising of the arm, or a tap on the hand to help initiate forming the pointing finger. Another form of non-vocal manding is eye contact. So it teaches attending to the therapist will help gain access to the mand. So oftentimes during engaging physical play, pause and present an SD, and then reinforce with more of that physical play once eye contact is made. So for example, you may be tickling a client and then pause, present the SD, tickles. The target response would be eye contact. If eye contact is made, reinforce with more of those tickles and extra verbal praise. When going through an eye contact request program, make sure to pay attention to seniors' notes for any prompting procedures, especially for time delays. Sometimes we have time delays of 3 or 5 seconds before we need to restart the trial. Another form of manding that we often see with our clients are PECS, or the Picture Exchange Communication System. It teaches relationships between pictures and the items that a client is manding for. So a client that will learn that picking up and handing the BT an image of an apple will gain access to an apple as a reinforcer. It often starts in a field of 1 and then is brought into wider arrays. And it's important to first run a physical preference assessment before the PECS trial to ensure that the client is pairing the image with the reinforcer and not just choosing images at random. Like any other program, if you have any questions about PECS, immediately reach out to your senior before running. it's important to remain consistent. The smallest variation in the program can result in confusing the clients or higher rates of error in the future. So just a quick example of what PECS may look like. You may have a picture of an apple on a binder or on a board somewhere in the therapy room. The client would hand the therapist the picture of the apple, apple, and then the therapist would reinforce with access to an apple. So when setting up interventions that build the use of vocal mands, it's important to gauge the learner's vocal abilities first. Oftentimes, for our early learners, one-word responses are more than acceptable and should be reinforced with both access to the reinforcer and then high levels of praise as well. Once vocal capabilities are more established based on your senior's programming, introducing sentence starters such as I want or give me can be introduced and then faded once the client is emitting them independently. With manding, it is important to pay attention to your own behavior as a therapist. When contriving mands, you really need to build up the buy-in. A client isn't going to ask for something that they have no interest in whatsoever. They're not going to, if a client isn't interested in playing with the doll or the stuffed animal that you've brought today, try modeling dancing with the toy to a highly preferred song to increase the motivation of play and the repertoire of play, and then reinforce manding of vocal emissions of dance or doll or song. In the same vein, make sure to create deprivation states of highly reinforcing objects to encourage spontaneous manding. If a client is satiated or tired of playing with a toy or snack, they're less likely to continue asking for it or spontaneously ask for it throughout the session. And then the last thing to look for in your own behavior is to avoid overuse of language such as, what do you want? Or tell me what you want. This will help avoid the client becoming prompt dependent on those phrases for their own spontaneous manding in the future. Alrighty, so manding is covered. Let's take a look at the next verbal behavior, which is echoics. Echoics are repeated or echoed vocal emissions. So for example, an SD could be, say dog. The target response would be the client responding, dog. Prompting procedures for echoics often follow shaping procedures. So you would reinforce accurately echoing the sound duh when prompted. And once that has become strong, then move on to reinforcing accurately echoing the sound daw when prompted. And then last but not least, reinforcing the full vocalization of the sound dog. Echoics can be developed and used in all ways, including for our more advanced learners. We often use them for phrasing skills to prompt appropriate language and responses during conversation programs. All right, next we have intraverbal. Intraverbal skills are vocal responses evoked by another person's vocal behavior. So often it's easy to remember it as listen, respond. Before teaching intraverbal, we often need to establish the vocal abilities through echoic programs first in order to widen the repertoire of independent vocal capabilities. So an example of an intraverbal program could be conversation, and we would start with an SD, what's your favorite color? And the client's target response would be green. For a prompting procedure, we would initially start with airless and then partial vocal, so g, to help lead the client to responding. Pay attention to the target response in each program. If the target response is correctly answering the question, what's your name? There's going to be a strict target response. However, if the target question is, what's your favorite color? And the response may vary. Our clients' favorite colors probably change every day or every week even. Alrighty, and last but not least, we have tacts. So tacts are comments based on observations that we make in our environment. So they're expressive labels of what we see, hear, smell, taste, touch. So similarly to interverbal behavior, it's important that we build up a client's vocal repertoire through echoics, just to make sure that they have the language to use. Language for tacting is often first taught receptively, so touch the picture that has waving. And an example of an SD would be if I was waving with the SD, what am I doing? The client's target response would be waving. Or if I presented an image, what is this? A client's target response would be apple. Again, for prompting procedure, first airless and then into partial vocal. So unlike manding, it's important to note that tacting is not reinforcement specific. So in our waving example, the goal is not for the client to ask us to wave, it's for them to accurately label the waving behavior. So reinforcement of labeling can be tangible or verbal praise, but it's important to remember that just waving and continuing to wave at the client is not going to be reinforcer enough. We need to reinforce them with a preferred item or that high vocal praise. Alrighty, so that covers our vocal and verbal behaviors for ABA. If you have any questions on any of these programs, make sure to reach out to your senior.